Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Now, across England and Wales, bereaved families are seeking answers about why their relatives have died of COVID-19. As this programme has reported previously, there has been controversy over the accurate recording of cause of death in many coronavirus cases. Now, there are allegations that guidance issued by the chief coroner as the pandemic began is likely to stymie, limit and frustrate the investigations into those deaths because it advised that inquests are not the place to discuss, for example, the adequate provision of protective equipment. Our Home Affairs correspondent Simon Israel reports.
Many families of the tens of thousands who have died from coronavirus were unable to attend the hospital bedsides and the funerals of their loved ones.
I must level with you, level with the British public. More families, many more families are going to lose loved ones before their time.
Now some of those families also argue they're being denied an explanation. A survey of coroners by this programme suggests they're facing a lottery for the chance to hold anyone to account for their loss. That's what the son of Dr. Peter Tunn wants. He wants to know why his consultant father had to die from COVID-19 while working at the Royal Berkshire Hospital.
I got to see him for about 30 minutes the day before he passed away and on the night he passed away. So we were rushed in because as a family I had to give them permission to turn off the ventilator.
You had to do that? That couldn't have been easy.
No. It was probably the hardest thing, yeah, I had to do.
He later found emails on his father's mobile which had been sent to hospital management asking for PPE. In one he warned, "It's only a matter of time before our ward patients and ourselves get infected." The response was, there were no hot patients, so no PPE. Dr. Tunn emailed back saying, by the time the ward was hot, it will be too little, too late. Dr. Tunn died on April the 13th. 2 weeks later, Berkshire's coroner's office notified the family it was not necessary to hold an inquest.
The official response was that there is no issues with the PPE, and they were following strict national guidelines. And the problem for me with that is, after going through what I went through, it's not really an acceptable answer.
The refusal came in the wake of the chief coroner's guidance to all coroners in England and Wales, in which he stated an inquest would not be a satisfactory means of deciding whether adequate general policies and arrangements were in place for provision of PPE. The Royal Berkshire Hospital is conducting its own inquiry, but Dr. Tunn's family believes that's not enough.
I have my reservations around the organisation marking its own homework, essentially. So for me, an independent investigation would be more worthwhile.
The organisation inquest has now taken up the case. They wrote to the chief coroner after his guidance was published, accusing him of trying to stymie, limit and frustrate investigations into COVID-related deaths of frontline workers.
This guidance is likely to lead to inconsistency across the country, and that means that deaths of key workers will not be subject to the proper scrutiny and be an opportunity to ask questions about how the government responded to this pandemic.
Channel 4 News surveyed 27 coroners across England and Wales, asking how many COVID-related deaths had been referred to them and how many inquests had opened by May the 8th. 12 replied. Inconsistencies were clear. Cumbria, which at one stage had one of the highest death rates in the country, had not opened a single inquest, while in Norfolk, 5 had been opened, and in central Bedfordshire, 71 COVID-related deaths had been referred. Other coroners refused to disclose any information at all. Dr. Tunn's case has been referred to the Health and Safety Executive.
the image of him on a ventilator is always in my mind. I can't get rid of it. And not knowing, having that image, and not having the answers does, if I'm honest, eat away at you.
How? What do you mean?
It's hard to fall asleep, quite simply. Like it's in the back of your mind throughout the day, because you're always wondering, why did it happen? How could it have changed? What could have been done differently? And the answers are not there.
In a statement, the Royal Berkshire Hospital told Channel 4 News,
"We have been entirely open and transparent with Dr. Ton's family. We will, of course, share the findings of the investigation with them on completion."
A spokesman for the chief coroner told Channel 4 News that the guidance is not intended, nor could it restrict, the permissible range of decision-making in a case. But as the lockdown eases, the grieving fades, there will be more cases like Dr. Ton's, and not just in the NHS, where demand for accountability will intensify.